I would like to turn it over to our next speaker, and I would like to introduce Dr. Sophia Jan. Dr. Jan is the Division Director of General Pediatrics, where she oversees clinical, teaching, and research operations for the Division of General Pediatrics for Cohen Children's Medical Center. She is also the Medical Director of the Health Homes Serving Children program for Northwell Health, a care management program for kids and young adults with complex medical or behavioral health needs. Dr. Jan has over a decade of clinical, programmatic, and research experience in general pediatrics and general internal medicine. She specializes in the care of children and adults with complex medical needs, intellectual development disabilities. While at the Children's Hospital of Philadelphia and the University of Pennsylvania, she created a transition program for young adults with complex medical and behavioral health needs. Currently, Dr. Jan is the principal investigator of several federally and foundation-funded research projects focusing on the delivery of healthcare and long-term care services for children and adults with chronic conditions originating in childhood. So with that, Dr. Jan, I will let you share your screen.
Good morning, everyone. Thank you for joining us on a Saturday morning. That is real dedication. I'm just going to look for, all right, can you see this okay?
We can, thank you.
Okay, great. I'm just gonna pull up one other thing so that I can actually see some of you, but maybe that won't happen. Okay, that's all right. So good morning. I'm thrilled to join you today. And again, thank you for joining on a Saturday morning. So I'm a general pediatrician and a general internist, and I take care of kids and adults who have who need lots of coordination of care. I also come to this as a family member. My brother Eugene actually has pretty profound intellectual disability, seizure disorder, and epilepsy. And when he was transitioning into adult care, it was extraordinarily challenging. And he experienced a number of injuries during his early 20s that really can be tied back to not being able to find providers that felt comfortable or could appropriately treat them. So I've since then basically just tried to spend my career through seeing patients and through my research and sort of through program development, just trying to find a better way. There just has to be a better way. And so, for today, this talk is really geared for all the adolescents and young adults who are in the audience today. This is for you. I think that at the end of the day, no matter how great your doctors and family members are, you are your best advocate and your best form of insurance to make sure that you stay healthy. You need, if you're going to take anything from this morning, it's that you need to be the expert of your own care, of your own body, of your own health, and that will give you the best insurance of being able to direct your care appropriately. So anyway, this is going to be interactive. I mean this to be fairly informal. You can, again, throw your questions into the box, and I will probably throw out some questions that I want you to think about, but honestly, I would love for you to respond in the box as well. So first, question 1. I know the name of my medical condition. No, I need to learn, or yes, I know this. Think about that. I know my symptoms, including the ones that need medical care quickly. No, I still need to learn this. Or, yeah, I got it. So as you're thinking about those questions, consider this scenario, and I'm going to put a little bit of a trigger warning because I think it can be a little bit traumatic. So last week, of course, was Passover and Easter, and so a lot of people had spring break, and maybe you may have taken a small day trip here or there. And so I want you to imagine that you and, let's say, your mom or dad are taking a road trip, a small road trip somewhere, and it's been pretty uneventful. You're driving through a more remote part of the state when suddenly your tire blows and your mom or dad loses control of the vehicle and you are like in an embankment. You're dazed, you feel, you're surprised, you're scared. You look over at your parent and they look okay, but they're actually fairly incoherent. Maybe they hit their head, but they're not talking right. Suddenly you've got EMS trucks and ambulance around you, and you're scared, and your parent is trying to answer questions, but they're not making sense. So the EMS workers come up and ask you, like, how are you? Are you hurt? Are you okay? What's your name? How old are you? Um, do you have any chronic conditions? Do you take any medications? Do you have any allergies? And then they put oxygen on your face, and they're getting your vitals. They ask, like, does your mom have any chronic conditions? Do you know if she takes any medications? Does she have any allergies? Um, and as you think about sort of this scenario where you are now like the one in charge and your mom or dad is incapacitated, can you handle that scary, scary situation? And I would argue that if you can get to the point where you can answer those questions, you have made it, right? Like everything else is so much easier. Like transition is just like a tiny little version, a much more benign version of that. Like if you are able to answer questions about your own health, and you might even be able to learn about the health of sort of your parents or those around you, that is the goal. Right. And if you another sort of really good example of why really taking control of your health and really knowing your medical condition is so important is, we're in the middle of a pandemic. Um, I have taken care of a lot of families where suddenly, like, of children and young adults who have chronic illnesses, and suddenly grandma is getting sick, mom is sick. They may or may not need to go to the hospital, but they cannot physically sort of like engage in the care. Because there's COVID in the household, suddenly the home health agency needs to pull out and there's no home health aide. And maybe like we were able to identify a cousin or an adult sort of aunt who was able to come in and sort of like quickly sort of be sort of the guardian in that sort of like scary scenario. But that aunt or cousin really doesn't know this child's care and this individual's care. They don't know, when you get your treatments. They don't know when you get where your medications are stored. And so it's actually not that as scary of a scenario this is. It is actually, it comes up, and it comes up not infrequently. And so think about all of this as like preparing yourself to be able to respond to that worst case scenario. Because quite frankly, everything else is so much easier. So next question. I know my medication, it's a statement really. I know my medication, what they are for, and I take them without reminders. No, I need to learn, or yes, I know this. I notice that no one is putting anything into the chat yet. What about, I know my treatments, for example, my physical therapy, my cough assist, my BiPAP, and when I need to do them. No, I need to learn this, or yes, I already know this. I mean, the good thing is that um, you don't really, there are lots of tools out there to help you and your family prepare you to sort of get to know these questions right away. And some of you already do, which is fantastic, right? And some of you still need to learn how to answer these and sort of how to manage things on your own. And so I'm going to go through sort of age, age by age, sort of what are some of the skills that you should really start practicing or getting to know. And, you know, here in this bottom left corner is this little icon for Got Transition. GotTransition.org is a wonderful website. And through this talk, I'll sort of introduce you to a few places where you can go to sort of, you know, download a little, you know, a small like, you know, kit or a few pages that sort of help you sort of think about what are the things that you need to learn. And again, as I go through this, it's okay if we're talking about the 12 and 13-year-olds and like, I haven't done that yet and I'm already 17, that's okay. You know, it's never too late, all right? So when you're 12 or 13, you should just start learning about your health conditions, know what your medications are, start learning about them, why you take them, learn about your allergies. And then start asking your doctor questions. Oftentimes, it may be your parent that's asking the questions in the room, but you should be the one who should start asking. And you should have your doctor respond back to you. And a question that's often scary is like, is there an age limit after which your doctor can't or won't be able to see you? It's an important one. And it's an important one to sort of know ahead of time because you don't want to be 20 and realize that there is a strict cutoff, age cutoff at 21, and you have no time to sort of prepare. So let's talk a little bit about learning about your health conditions, meds, and allergies. So there is a fantastic transition toolkit that's geared for Duchenne muscular dystrophy. Now, I know many of you may not necessarily have Duchenne muscular dystrophy, but it actually serves as a really good framework and a guide on sort of some of the things that you should know. And actually, a lot of the things that are here are sort of widely applicable. So even if you don't have Duchenne's, it's also a great way to sort of go through this checklist and sort of get a chance to learn what you might need to know. We had kind of gone through some of the questions that I had included earlier in the talk, but here's another one. Do you know the phone number for your doctor's office? I know that you have many doctors. You have primary care, you've got your you have your pediatrician, you've got your pulmonologist, maybe your like your rehab doctor. But do you have all of their numbers? So yes, I have the doctor's office on my phone. No, I've been meaning to do it. Huh, I haven't thought of that. And it's not on my phone, but I can find it easily online. And so I think, Laura Q, you're asking where you can find the DMD checklist. I will tell you in a moment, but it's actually published. So if you actually Google it, you can probably find it. It was published in Pediatrics, and I'll post a link later on. There's a tiny little thing at the very bottom that tells you sort of where it was published in Pediatrics, but actually it's Googleable. And it actually goes into quite a bit of detail and across multiple domains about what are some of the micro skills that you should know and start to practice. All right, your age, you're now 14 or 15. You should learn what are emergencies, what are considered emergencies, and what you need to do about them. You should start carrying your insurance card and emergency contacts. I hope everyone here is doing that, but if not, do it right now. Ask your parent for a copy of your insurance card and start plugging in sort of your emergency contacts on your phone. Start carrying your medications. Practice making a doctor's appointment. If you're in high school and you can sign on to sort of your online classes, you can make a doctor's appointment. Practice ordering your prescription refills, and most important, or not most, but very importantly, start talking to your doctor alone. At age 12 in primary care, we often will separate the parent from the teenager so that we can have a few minutes to speak about issues that you may not necessarily feel comfortable talking about in front of your parent. But it's a chance for you to ask questions and for me as the doctor to be able to speak to you directly and for you to sort of ask questions directly without your mom or your dad answering for you. And so it's really important. And actually you can request that. And if for the parents that are in the audience, really encourage your daughter or son to sort of talk to the doctor alone and respond alone. Again, in primary care, we're better at it. In specialty care, we're notoriously bad at it, but you really should insist on doing that. So let's talk a little bit about emergencies. Have you set up your medical ID on your phone yet? Why would I need to do that? No, I haven't done it yet. Or yes, I have. So all phones, Apple and Android phones, have a way to sort of put in a medical ID. Basically, it's this idea that in case of an emergency, even though your phone may be locked, you can, swipe and be able that anyone, including paramedics or EMS, would be able to pull up this medical ID on your phone or on your parent's phone. Everyone should have it set up because it will include sort of medical conditions, major allergies and reactions, medications. It'll include just some identifiers and probably importantly, your emergency contacts. So do you know what to do if you feel really sick, but the doctor's office is closed? Are you going to go to the ER? Are you going to just bear and grin it at home? Are you going to tell your parents? Are you going to tell someone else? Do you know what to do? What if you don't have someone to ask? So the parent Project Muscular Dystrophy actually put together a really nice emergency card that for a lot of individuals with muscular dystrophy as well as other neuromuscular conditions, there are some things that are completely contraindicated, as hopefully you know. But there are also some things that we as doctors may not immediately think about because we don't see it so often. So one example is if you have a broken bone, for whatever reason, you have a fracture, you fell, there's this super rare complication called a fat embolism that can happen, and it can be extremely dangerous and potentially fatal. It's hard to diagnose, and unless you're thinking about it, if the doctor is thinking about it, they may not know to look for it. And so having a card like this actually is really helpful for both you to tell your medical team, wherever they may be, even if they are experts in neuromuscular disorders, sometimes people may not always think about these rare things. And so it's good to have a card like this, if many of you maybe are on steroids and you have adrenal insufficiency. So when you're sick, you need to sort of get stress dose steroids. And this is just an important reminder when things are crazy and there's other things that may be happening from your, chronic condition standpoint, that people don't forget that actually we may need to add on stress dose steroids, or that succinylcholine as an anesthetic is never allowed and completely contraindicated if you have muscular dystrophy. So these are just I actually think that this wallet card is extraordinarily helpful, both for families as well as for healthcare providers, and is from the parent Project Muscular Dystrophy Association. Again, I will tell you that MDA as well as the Parent Project Muscular Dystrophy Association have wonderful, wonderful resources. If you haven't explored it yet, definitely follow Nicole Petruski's advice and explore those websites because they have been very well thought out. All right, next question. What should I carry with me at all times? Your insurance card. Always have that with you. The medical ID on your phone I just told you about. Contacts for all your doctors and therapists. Include that in your medical ID. You should sort of have all of your necessary medications, the treatments that you need, the respiratory treatments that you may need, any assistive devices that you need. carry that emergency care considerations, which is this little card that I told you about, or have it somewhere. And really great is that if you have a medical summary or the last note from your neuromuscular team, because oftentimes those notes are super comprehensive, and if you get one copy of it, it will help anyone in any setting sort of like know what to do. And so I encourage all of my teenagers and young adults to carry these 5 things and not be dependent on other people to carry it for you. Like, you should have it on yourself or be able to direct someone to, get it from your bag. All right, so now you're 16 or 17. You should start to make your doctor's appointments, not just practice, but you should start making them yourself. You should start talking to your doctor alone routinely. You should ask your doctor about privacy rights at age 18, and we'll get to that in a moment. Start making a medical summary with your treating team. And we'll talk about that in a little bit more detail. Determine if you're going to need help making healthcare decisions. We'll talk about that and go into a little bit more detail as well. And then talk with your family about when to transfer to an adult doctor. So let's go into some details here. First of all, do you know how your healthcare privacy changes at age 18? I know what happens with my medical, either you know what happens with your medical records or medical decisions when you turn 18. Yes, I do. Or for many people, I'm not sure. I know that some things change when I turn 18. You get to vote, but I'm not actually sure what happens. And so for a lot of people, I have no clue. Something changes does something actually change? So you may not feel any different when you turn 18, or you may be extraordinarily happy that you're now 18 years old. But legally, you are now an adult, and that's a very important distinction. So after you turn 18, your doctor starts to talk to you, not your parents, about your health, unless you give the doctor permission to talk to your parents about your health. Your health information and your medical records are private and confidential, and they can't be shared with your parents, for example, unless you give the permission, unless you give the okay. And it's up to you at this point to make decisions about your own care. Even though you can always ask people for help, at age 18, you are a legal adult. I, as the treating physician, am legally obligated to adhere to respect your decision and not necessarily your parents. And so you should know that basically there's some caveats to this, which is that, many of you know about HIPAA, which is a law that protects your privacy and from sharing. It's basically saying that what is discussed between you and your doctor is confidential and it can't be shared with other people. This law does actually give rights to minors, people under the age of 18, to make their own decisions about certain kinds of services. So, for example, if you wanted to make decisions about birth control, reproductive health, mental health, you have depression, and for whatever reason, I hope you always will speak to your parents about this, but for whatever reason you can't speak to your parents about depression or anxiety and you need to get treatment, you can make some of those decisions. Or that you have a substance use problem, that you are starting to smoke weed and it's becoming problematic and you want to get treatment for it. Those are decisions that you could potentially make on your own without the consent of your parents. That being said, I always think the best approach to this is always consulting your family. You make better decisions that way, but just know from a legal standpoint that you have those rights. But let's say you need help with decision making. There are, and all of us need help with decision making. It actually doesn't matter how old you are. I'm in my 40s, and when I make healthcare decisions, I ask my sister and I ask my husband. My parents, who are in their 70s, when they're making decisions about their health, they ask me about my opinion. So it's not to say that everyone doesn't need support for medical decisions, but you, once you turn 18, you are in charge, unless you don't necessarily have the capacity to make that decision, and legally we make sort of modifications to and allow other people to be part of that. So guardianship is something that is an option for those individuals who really have no capacity to make medical decisions on their own. For example, my brother, who has severe intellectual disability, he can't speak, he probably functions at the level of a 2 or 3-year-old. He can't make decisions on his own, and so we applied for a legal guardianship for him. But that needs to be done ideally before the age of 18, because for many people who might be on the border where they can probably make some decisions but not for others, in a, you know, while most physicians would certainly invite family to be part of those decisions, oftentimes surgeons, especially when there's an elective procedure that needs to happen, if you need to have an operation, they need to know who is the legal guardian. If you're an 18 or 19 and you don't have one of these other arrangements, the parent can't sign consent on behalf of that young adult unless there's a guardianship or supported decision making sort of like paperwork in place. And there's some other things that are really important for you to start thinking about with your family. There are some states that allow legally supported decision making, which means that you can designate an individual to help support you for some life decisions, but not for others. And then, but it defines what domains that someone else will make that decision for you. And then I think something that everyone should have, but particularly everyone should have no matter what, are advanced directives, basically a healthcare proxy. Healthcare proxy, as well as sort of potentially a living will. So basically a healthcare proxy means, let's say, let's take that example from the very beginning, where you and a parent are in a car accident and your mom or dad suddenly doesn't have the capacity to make decisions because they are out of it, they are not speaking coherently, they're not really understanding the questions. In that situation, it's really important that your parent have a healthcare proxy, which means that in those situations where they can't make decisions for themselves, that they have designated somebody who they trust to be that person. And maybe that is the spouse, maybe that is your aunt or uncle, someone, but it needs to be sort of designated. Otherwise, by law, someone will make that decision for you. So we can talk about this in quite a bit more detail, but it's important to think about sort of the healthcare proxies and these other sort of advanced directives, in part because if you probably want to make sure that your decisions and your values are being taken into account when people are making decisions about your care when you're unable to express so. And so if you are someone that says, I never, ever, ever want a feeding tube, then unless you have that written down somewhere, your desire may not be upheld unless you have sort of some of this paperwork in place. And also, I mean, I think if anything, what's most important is having these discussions. Before we even get to the paperwork, it's actually having these meaningful discussions about who should be your healthcare proxy, who should be your durable power of attorney, what are things that are acceptable to you? What are things that are not acceptable to you? And having that, conversation with your family, and then later on having that conversation with your doctors. Okay. Moving on, there are actually a lot of really good resources around this to help people think about what kind of, where they may need some extra support. Charting the Life Course is actually this really nice website. It's called chartingthelifecourse.com. And they actually sort of go through multiple different domains where you can sort of decide, I can decide this with no extra support, or I need support with this decision, or I need someone to decide this for me. And it goes through lots of things like your daily life and employment. It goes through, sort of things around your medical care. It actually goes through things around recreation, day-to-day, jobs, where you want to live. And so it's actually a really nice resource for you and your family. All right. So I think here was where I wanted to say, like, one of the things you should probably talk about is, about transferring to an adult doctor and what's the right time to do that. There actually is no right or wrong answer. There are some children's hospitals that have a very strict cutoff age for legal reasons. One example is DuPont Children's Hospital in Delaware. They are legally chartered, to only take those who are under 21. And once you're above 21, they have to transfer you to a different facility. There is just like no choice there. Whereas at Children's Hospital of Philadelphia, for example, where I used to be, or currently at Cohen Children's, it was more flexible, where at CHOP, we oftentimes had folks who were in their 30s, sometimes even in their 50s with congenital heart disease, like there, right? And so it really depends on sort of what that institution's policies are. And so we'll talk a little bit more about that, because I imagine there's a lot of questions around this. The other thing I want to emphasize is that if you have learning disabilities, it's really important to get one more psychosocial evaluation, basically something to evaluate your learning disabilities before you leave high school, because that is the only time when the school districts are legally obligated to do an evaluation, which will help you a lot, both for getting services later on when you turn 21, or when you're going to college or some other vocational school to get you access to services. But a lot of services are tied to what the determination is on your psychosocial evaluation. And once you leave high school, getting a psychosocial evaluation is very challenging. Actually, I shouldn't call it a psychosocial evaluation. It's really like a neuropsychiatric evaluation. And it costs thousands and thousands of dollars to do it after you leave school. And so it's really important to try to get one done before that, because that's when insurance will pay for it. All right, so what if I just don't want to transfer to an adult provider? I get this all the time, actually, not just with families, but with many, many medical treatment teams as well. So what if I just don't want to transfer, right? And actually transferring is really hard, right? Because, your pediatric treating team loves you, you love them. It's hard to, many of the neuromuscular conditions are rare, and it's hard to find experts in the adult arena. And it's complicated. You're seeing a lot of specialists, and so it's hard to sort of do all of that. But on the other hand, I think it's entirely possible, and we'll talk a little bit about how to do that. But the problem is that when it's not planned, you could end up in an adult ER in an adult hospital anyway. Just like, that scenario that I brought up. Like, you may be traveling and you end up in an adult provider, and you don't have sort of like an adult ER, and you don't have, the infrastructure set up before that happens. There are lots of licensing restrictions Give me one moment. I'm going to just change out my battery on my headset. Okay, great. So there's lots of licensing restrictions, particularly for a lot of the professionals that you really rely on, like your nurses, your LPNs, advanced practice practitioner, nurse practitioner, or the PA, PT, OT, speech. There's a lot of restrictions where their license doesn't allow them to practice beyond a certain sort of age. And also, like, they may not really know, once you are in your 20s, they may not know the really good adult resources, like adult therapists or behavioral health, like they won't have good sort of referrals. And then there's really limitations of clinical knowledge, like that I as an internist, I can see where my pediatric colleagues really struggle in some of the medical issues around health maintenance, preventive care, as well as some of the chronic conditions that come up as an adult. They really struggle with it. There's no way for them to be experts in both of that. And so that can lead to dangerous situations as well as them not knowing who to refer to when those things come up. Any other challenges are like you don't want to be in your 20s and be treated like a child, like at a children's hospital, or rooming with another, 2-month-old next door. It's awkward. So let's talk about what happens. Let's talk about the medical summary. You can make a medical summary. It's probably one of the most important things for you to do with your family and with your doctor, and then to keep a copy of it around with you. I did a survey in Pennsylvania of all the adult doctors in the Philadelphia area, and their number one, what they needed most, that they thought was absolutely necessary for them to sort of assume the care of a young adult with a chronic condition, is a medical summary, and they need the medical records prior to the visit. And I cannot tell you how many times as an internist I would see somebody with who is clearly had had a home ventilator, was, in a wheelchair, had a speaking communication device, and I had no records at all at the first visit. It's incredibly frustrating for both the family as well as for the treating provider, as well as it kind of is dangerous. So medical summaries, there are great tools. Again, that sort of like Duchenne medical dystrophy checklist, as part of that, there's a nice 3-page medical summary. And you can go through it. Talks about the advanced directives, talks about what the diagnosis and problem list is. And the idea here is not for you to fill all of this out. The idea is that you bring a little bit of it, and each time you are working through one little section with your doctor, like, okay, so what's my history around my lung history, and sort of what's the most important thing? And actually, most of your treating team has it in their note anyway. Their notes are really comprehensive, and it actually serves as the medical summary, but you really need a copy of it. There's a lot of these other organ systems and specialists that you need, that the next treating doctor will need to know. And again, a lot of the medical summary here includes those emergency care considerations that I was talking about earlier. Okay, and then the other thing that's important in your medical summary is all of the equipment and orthotics and the supplies that you need, which arguably is like some of the most important day-to-day items that you need. All right, so one more question. Do you think you can fill this medical summary out a little at a time with your doctor's help? Yes, definitely. Not sure? No, definitely not. All right, so I'm going to this is kind of I'll finish up soon because I want to give a chance to answer questions. A lot of times, many people ask me, what is the best approach to transferring the care? Like, you've got multiple specialists, like who goes first? Like, how do you even find an adult doctor? What's the process? So these are my recommendations. This is not, I think that it changes from location to location. But I think as a general rule, what is most important is that you need to know who your adult quarterback is. Who is the adult provider who's going to be quarterbacking this team? In pediatrics, for some of that, it's your neuromuscular team, right? It might be neurology. In some institutions, it's pulmonary. In some institutions, it's the rehab team. Who is going to be that primary person in the adult side? And it may not be the same specialty on the adult side. Sometimes it's going to be a really invested primary care doctor, and that's what the function that I always served for my patients on the adult side is that I'm a general internist. I don't know a ton about sort of all the different specialties, but I will make sure that I find you a pulmonologist, and I will try to find you, a rehab doctor. And then once you find sort of who that quarterback is, and you need to know whether or not they're accepted by your insurance, because if you need to change insurance, you know that that will impact so many other aspects of your care, which is it's going to affect your home, potentially like your home health agency, your home nursing. It may affect your DME supply company. It takes a while to set up the pharmacy things. And so sometimes you need to make a decision. What's more important right now? Keeping the same nurse or keeping the same sort of DME company, or sort of like moving on to this like new doctor who seems really great. Those are hard discussions, but those are ones that you need to have with your treating team. And in terms of how you find them, right? Hopefully that your specialty team has some recommendations. And then otherwise, it's also like, who are your parents seeing for their primary care? And then from that primary care doctor, who are the specialists that they oftentimes will refer to? And who are the pediatric specialists referring? Go to your insurance company and ask them, where are there sort of like good doctors that can sort of taking on new patients? I, in general, think that going to an academic medical center, a big sort of teaching hospital, is probably better for you who may have a more complicated neuromuscular disorder or muscular dystrophy, because you need a lot of specialists, you need a lot of specialized care. It's better everyone to be under the same roof, if at all possible. It's the ideal. So if you can find someone that is all tied to one academic medical center, I feel like that tends to trump all other things because it facilitates the communication much better. And then the old pediatrician needs to send a lot of the letters of medical necessity and prior authorizations and notes, because oftentimes as the adult receiving doctor, I have to rewrite all of those, and having somebody else sort of see what other people have written in the past to sort of get you authorizations and get approvals is extraordinarily helpful. And I think the other one thing that is a little bit harder to find on the adult side is dietitian services. There's a good dietitian who's affiliated with GI, sometimes with the neurology team. It kind of depends on your institution. On the adult side, it's a little bit harder because many of these specialists don't necessarily have a dietitian, and so I oftentimes struggle a little bit trying to find a dietitian. So oftentimes I tell my families, make sure that you get a really good nutrition sort of like evaluation before you transfer. And so that way I can use that to justify sort of all of the other things that you'll need moving forward, tube feeds or anything else. Okay, and with that, I am just going to pause and sort of summarize. So summarizing, taking charge of your health, transitioning to adult care, it is not easy, but you can absolutely do it, especially if you start early and learn things little by little over time. Use the Got Transition Family Toolkit as a starting point. Use the Transition Toolkit for Duchenne muscular dystrophy to get a little bit more details, and also as another starting point. And again, what should you carry with you at all times? Insurance card, your medical ID on your phone, contacts for all your doctors and therapists, your medications, treatment, and assistive equipment, your emergency care considerations, and your medical summary. And with that, I want to thank you all.
Thank you, Dr. Jan. I think it was interesting for me to listen to that. I have a fifth, or he will be 15 in a couple of weeks, and I honestly don't think he doesn't know his doctor's number. You know, it's in my phone, not in his, and he doesn't carry his insurance card. So I think this is a lot of pertinent and relevant information that can be reached across everyone who's listening today. And just to, you know, if for an example, you said to make a copy or to use the Duchenne card as a reference, they could do something like that to tweak it to their own diagnoses, correct?
Absolutely, that's the point. And actually, the Duchenne muscular dystrophy transition toolkit was actually based off of a GOT transition generic one. And so
Okay.
every group has actually been trying to tweak it a little bit. And that's the whole point. It's generic enough and broad enough that you can sort of adapt it to what you need. And you have to.
Sure. We got some thank yous in the chat. A few people answered your questions.
Yay, thanks.
You never know exactly who's going to answer. I do not see any questions that have popped up after your presentation. So I know a couple people had asked if it had been recorded. There's a lot of information that you shared. So I do appreciate your time this Saturday. And if something comes up in the interim, someone just typed in, is POA good for health decisions?
Is a power of attorney good for health decisions? Well, it depends on the situation, right? The power of attorney is used when, so what the power of attorney and healthcare proxies are when you are unable to make a decision, it's for you to designate someone to make those decisions for you. So it's not a way to help you make decisions. It's a way of identifying someone that you trust, who is someone that shares your values, to be able to help you make those decisions on your behalf should you not be able to. So I did want to make that distinction.
All right. That's a really good point. This Connie commented, you really have us thinking and realizing how much we need to know. I agree. I feel like I'm slacking here. Where do you go for a neuropsychic evaluation?
So I think that first would be go to your school. If you have a learning disability, you have the right, once you sort of write as part of your IEP, for example, many of you do have an individualized education plan. Mm-hmm. So you just write to your school district and say, I'm requesting a neuropsych evaluation. The part about going through the school districts is that it takes a long time. There's a long wait list, right? And so you can also potentially go through your insurance and go through sort of their pediatric health system, but oftentimes it takes longer. It may be more costly, but in general, most school districts are required to sort of perform one, particularly if you ask.
Okay.
Well, thank you so very much. This has been fun.
Thank you very much for your presentation.